Hi, I'm Jack Cush reporting to you from Vienna and Eular 2025. It's the first day of the meeting, a lot of interesting things. I heard a message several times today, and the message being our thinking on steroids in lupus is changing. One such abstract where that's portrayed is this abstract OP0059. It was an oral presentation in a lupus session presented by Dr. Ashkenazi, with other authors being Ken Kalunian and Maria Delara, talking about how we treat lupus nephritis patients. And this was a reanalysis of data already presented. One study being the ALM study, and two other studies were the Aura-LV study and the Aurora-1. In this study, they did a propensity matching, and they compared the ALM study to 179 patients to 179 in the Aura-LV plus Aurora-1 study. And they wanted to look at outcomes, renal outcomes, which was the primary endpoint, but also side effects and whatnot. The main differences were A, in the immunosuppression. The ALM study received either up to 3 grams per day of mycophenolate or IV cyclophosphamide, and a higher dose of steroids, starting out at 60 milligrams per day, lowering every 2 weeks until they got to 10 per day, but with not a lot of success and a lot more overall steroid exposure in the ALM study. That was compared to the Aura-LV and the Aurora-1, where the patients received 2 grams of mycophenolate plus Voclosporin, the lower daily dose, plus steroids starting at 25 milligrams per day, and then decreasing down over 16 weeks to 2.5 milligrams a day. That second group, the Aura-LV, Aurora-1, had less steroid exposure, but also had the addition of the Voclosporin. They called that triple therapy. I don't know if I agree with that. Mycophenolate and Voclosporin, that's double therapy. Adding steroids to that, I don't think that we're using enough steroids to consider for this to be truly immunosuppressive, but they called it triple, with the third big drug in there being steroids. The end result of this was that there were more side effects, AEs, in the ALM study than in the other two. SAEs were the same. Serious adverse events were the same. But the Aurora-LV and the Aurora-1, Aura-LV and Aurora-1 had met its urinary renal endpoints, and that being a 50% reduction in UPCR and whatnot, and overall had less steroid toxicity. So, yeah, it makes sense to use combination immunosuppressors in lupus nephritis. But I think that you're going to hear at this meeting, as you get from this particular trial, that limiting steroid use is going to be important in the overall success. And success is not just measured by getting to that renal endpoint, but also how much toxicity you're going to incur along the way. Anyway, that was an interesting one from Eular 2025. Tune in for more at Room Now.